Hello, Colorado. Thank you for joining us today. Earlier this week, we jumped to over 1,000 hospitalizations for COVID in our state. This is a very stark reminder for anybody who thought the pandemic was over, they could slip by without getting vaccinated. This is a wake-up call. If you haven't been vaccinated, you are facing a grave threat of the deadly virus everywhere you go. And it's really important that you get vaccinated to protect yourself and protect others. For many folks who are listening, you've gotten your two vaccination doses. You're wondering, what else can I do? Two things. One is get the booster. If it's been 6 months, get the booster. Pfizer's already approved. Moderna and J&J should be available really in the next day or two. We're expecting those will be available for everybody in the case of Moderna and Pfizer that got vaccinated 6 months ago, and really everybody who got Johnson & Johnson even 2 months ago. It's important to get the booster. I'm hopeful those recommendations will also allow, as the data strongly indicates, that mix and match works as well, or potentially even better. Just to highlight the importance of the booster, on the Pfizer data that was just submitted, which is 10,000 people. That's a very big study group. 5,000 were not boosted, meaning they got their 2 doses. The other 5,000 got a third dose. Out of the 5,000 that just got the 2 doses, they had 109 that got COVID. For the patients that did get the booster, they only had what is the number here? Let's see. I'll get the number and I'll find it here and get back to you, but it's very, very low. Must be on the other file. That really shows the importance of why, and I'll highlight the numbers here and you'll see them in a moment, why this is important. It was 95.6% effective at preventing a COVID case with symptoms, which is obviously an important thing to protect against. With 10,000 participants, only 5 cases of COVID for people who got their booster, and 109 for people who didn't. So I'll start again so you can hear this again, because you really need to hear this. Whether you got Pfizer, Moderna, or Johnson & Johnson, time to get the booster. If you haven't got any, you're facing a really big threat right now, and I encourage you to get vaccinated. But if you got Pfizer or Moderna 6 months or more ago, Johnson & Johnson 2 months or more ago, very important to get vaccinated. The recent data that came in, 10,000 people, 5,000 got the 2 doses of Pfizer, did what initially we thought we were supposed to. The other 5,000 got the booster dose. Of those 5,000 people who didn't get the booster, 109 got symptomatic COVID. Of the 5,000 who got the booster, only 5 got symptomatic COVID. Over 95% reduction from the booster. It's important for ourselves. My parents, who are 77, have been boosted for some time. I plan to get boosted very shortly. I got the Moderna vaccine. We expect the final approval will occur in the next day or two. I will waste no time in getting my booster because the data is off the charts. And that should be a clear message to ourselves, of course, to protect yourselves, but also, as we're going to get into, to protect our hospital capacity in our state. It's really about 3 things at this point. Accelerating the number of people who get their first and second dose. Number 2, getting the booster dose to everybody who got the vaccine 6 months or so more in Moderna and Pfizer, 2 months ago or more in Johnson & Johnson. And third, successful implementation of the vaccination program for people aged 5 to 11, none of whom have immunity from vaccinations at this point, other than a handful of kids that were part of the tests in Colorado. And, of course, continuing to work on the 12 to 17 age group. So you're going to see a major push from us on, of course, boosters, on first and second doses, and on 5 to 17-year-olds. Because we've got to end this pandemic. And until it ends, especially if you are unvaccinated, I want to emphasize the importance of wearing a mask indoors around others. If you're unvaccinated, you are taking a great risk if you are going unmasked in public areas, given the prevalence of this virus. If you are vaccinated, it's highly effective. Some people who are vaccinated still wear masks for additional protection. But if you're unvaccinated, I just want to mention how imperative that is that you protect yourself, because we are nearing the capacity of our hospitals, about 90% of the beds, and Scott will get into that. We are at 1,130 hospitalizations, and I want to be clear, about 900 of those, 893, are unvaccinated. And of the 200 or so that are not, many of those can be avoided with boosters, because those are mostly folks in their 70s. The average age of a vaccinated person in the hospital is 73, and many of those can be avoided by boosters. Older Coloradans over 50 need boosters even more. The average age of unvaccinated in our hospitals is 57, meaning there's unvaccinated 30-year-olds right along unvaccinated 70-year-olds, and they still have the very high hospitalization rate and death rate if you're unvaccinated. So please, if you haven't been vaccinated, get vaccinated. If you have been vaccinated, get boosted. My loved ones have. In addition to the 1,130 hospitalizations, there are a subset of that. We have 25 children being hospitalized. 16 of them are 0 to 11, and 9 of them are 12 to 17. The 9 that are 12 to 17, unnecessary hospitalizations, because everybody 12 to 17 can get vaccinated today. And there is no need for a kid who contracts COVID to be hospitalized, because the vaccine will prevent that. And of course, we are very hopeful that it will be available soon for 5 to 11-year-olds, which is a big piece of that 0 to 11-year-old population, and allow us to start making a dent in reducing hospitalizations for 0 to 11-year-olds. I think that all of us are really more than tired of this pandemic. But the pandemic, the deadly COVID-19 virus, is not tired of us. The biggest change from where we were a year and a half ago when this came and we had some of our initial scares with hospital capacity, the biggest change is we have the tools to end it. Getting vaccinated, the first and second dose, first and foremost, everybody 12 and up. Getting the booster, especially if you're in your 60s, 70s, 80s, 90s, get it now. Any age, get it now. I'll be getting mine in the next few days. My parents had got it a month ago. And then making sure that if you're the parent of a 5 to 11-year-old, and I have a 10-year-old and a 7-year-old, that we are eagerly awaiting the news in early November, probably in 2 or 3 weeks, that we'll be able to move forward with protecting our kids. Those are the steps we need to take to end it. The most hopeful day of this entire pandemic for me is when we receive those very first vaccine doses at FedEx, at the state lab. And never in my wildest imagination did I think there would be Coloradans that didn't want to protect themselves, that didn't love themselves enough to almost eliminate their risk of being hospitalized. And for younger people, like I guess, vis-a-vis the virus, even at 46, I'm considered a younger person. The risk of hospitalization if you're vaccinated is very close to zero if you contract COVID, very close to zero. Of a severe health outcome, if you're in your 30s, 40s, very, very low if you're vaccinated. Much higher if you're unvaccinated. It can take a perfectly healthy 46-year-old like me who's unvaccinated, and you have as much as a 1 in 10 chance of being hospitalized if you're unvaccinated and contract COVID. Now, for people in their 60s, 70s, 80s, the vaccine is highly effective, reduces your risk of hospitalization significantly. Dr. Hurley, he will get into that. But it doesn't guarantee that like it does for younger people. So I still encourage, especially those who might be more vulnerable to the virus, to take precautions, be smart, avoid large gatherings, wear a mask around others. But first and foremost, show that you love yourself, show that you support your friends and family that want you to be here for many years to come. Get protected, get vaccinated, get boosted. I'm now going to turn it over to Dr. Rachel Hurley and Incident Commander Scott Bookman to discuss the trends, the alarming trends we're seeing in Colorado, and make sure that people know that it's really up to us to change these trends by protecting ourselves with a highly effective vaccine. Dr. Hurley?
Thank you, Governor. Good afternoon. I want to focus my update today on some of our hospitalization trends. If we could pull up the slides, please. So this particular figure shows you the difference in hospitalization rates here in Colorado compared to the U.S. What you'll notice if you look to the far right end of this figure is that the U.S. has experienced a pretty rapid decline in the number of hospitalizations. That's tracking closely with the case trends that we're seeing across the U.S. right now. There's obviously variability across the country in what we're seeing. We know that there's lots of factors that go into trends in different parts of the country. Some of this might be seasonality, but unfortunately what we're seeing here in Colorado is an increase in hospitalizations right now that is really tracking closely with this extended, stubborn, high plateau that we've had in Colorado for cases for really about the last 2 months now. So while we're seeing this decline across the U.S. overall, unfortunately the trend is different here in Colorado. Next slide, please. And the increases that we're seeing in hospitalizations are really across all age groups. So this figure is showing you hospitalization trends by age group, from under 18 shown in yellow all the way up to 70 plus shown in purple in this figure. If you look closely at this figure, you'll notice that the rates are increasing a little bit more rapidly though in some of our older populations. Specifically that 70 plus population, you can see that steeper trend line there than we see with some of the other age groups. And part of that may be due to what the governor was discussing, the waning immunity that we're seeing that we know older individuals are more susceptible to. We know that our older age groups might have less robust immune systems and might be more susceptible to see their immune system wane over time. And so again, this is an important reminder of the importance of booster doses to protect individuals who are at higher risk of severe disease, especially hospitalization or death. Again, those booster doses are recommended for many groups, and we encourage all of those groups to receive the booster dose, but certainly very important for our older Coloradans right now. And we know that the data that the governor discussed from Pfizer is very promising, showing the really high levels of effectiveness associated with these booster doses, and that follows other really important observational data that we've seen from other countries like Israel, where they are further along in their booster dosing programs and are really seeing remarkable changes in their trends in cases and hospitalizations. Next slide, please. So next I want to go dig a little bit deeper into some of the hospitalization trends that we're seeing by age group and by vaccination status. So this figure is showing you the risk of hospitalization for those that are unvaccinated compared to those that are vaccinated, and showing those differences by age group. There is some variability across age groups, but overall we see that hospitalization rates are 8 to 20 times higher in unvaccinated individuals than vaccinated individuals. You'll see that RR value, or rate ratio, so that's the difference between the rate we're seeing in unvaccinated versus vaccinated, is around 8 for people over the age of 70, but as high as 20 or higher in some of our younger age groups. Again, significant protection that we're seeing from vaccination in individuals that we're seeing among individuals that are at risk of hospitalization. So again, important reminder of the importance of vaccination preventing hospitalization, and again, for those older age groups where we see that smaller ratio, an important reminder for booster doses to have that added protection against severe disease. Next slide, please. Next, I want to share this geographic trend with you. So this is a figure that I frequently share with you to explain some of the variability in geographic trends in hospitalizations that we're seeing across the state right now. So this figure is showing you the correlation that exists between our hospitalization rates and our vaccination rates. So if you look at the far lower right-hand corner of this figure, that's where you see the highest percentage of Coloradans by county that are vaccinated. And you'll see that those are also the counties where we're seeing the lowest hospitalization rates right now. So again, counties with the highest vaccination rates are those where we're seeing the lowest hospitalization rates. And then we also see, conversely, where we are seeing the highest hospitalization rates tend to be our counties where we have the lowest vaccination rates. Again, an important reminder to us that vaccination is protecting our communities from hospitalization and severe disease outcomes. Next slide. A little bit more information about some of the geographic variability that we're seeing right now in hospitalization trends. So this is a table that is comparing the percentage of hospitalizations that are occurring in certain regions of the state to the overall percentage of the population that lives in those regions. So specifically, if you look at the metro area, either the 5-county metro area, which would be Adams, Arapahoe, Denver, Douglas, and Jefferson, or if you add on Boulder and Broomfield, you'll see that in general, we're seeing fewer hospitalizations in those regions compared to their population overall. small, meaning that our hospitalizations are underrepresented from the metro area. Conversely, we see the overrepresentation from Larimer and Weld right now, El Paso County, and then all other regions of the state. So we're seeing, again, overrepresentation among our hospitalizations in those regions of the state where we see lower vaccination rates right now. Again, important reminder of the importance of vaccination in protecting our communities and protecting individuals from severe disease. Thank you.
I want to introduce Scott Bookman. Before that, go back to the chart that shows the different counties and where they are. This is also a hopeful chart, because if you look at where Eagle, Broomfield, and Boulder are, right around 80% vaccination, you see a quarter of the hospitalization rate. So, I mean, if that was the rates we had statewide, we wouldn't even be here giving an update. If we had 200 people, 300 people across the whole state hospitalized for COVID at this time, we would not have a hospital capacity issue. We wouldn't have 1,000, 1,100 people in our hospitals. So let's be hopeful. Communities can aspire to that. When you can reach those levels, you get around 80. It really shows there's a inception point. When you get to about 80% protected, there is a significant herd immunity impact, and your hospitalizations go down several times. You see, 1/3, 1/4 the rate of hospitalizations as some of the counties that have lower vaccination rates. So let's be hopeful about this. Let's aspire to achieve those rates, and let's actually do it. I mean, if you haven't been vaccinated, go out and get it done. If you've been vaccinated, get that booster. With that, we'll turn it over to Scott Bookman, Incident Commander.
Thank you, Governor, and thank you all for joining today. We can move to the next set of slides. Thank you. I do want to start again by thanking all of our healthcare workers on the front lines. They are true heroes in the response to this pandemic. And it is unfortunate that we are here today to talk about this, the continued conversation about the pandemic of the unvaccinated. And what you see here on this slide is the continued upward utilization of our ICU beds in the state of Colorado. Prior to the pandemic, historically, we saw about 68% of our hospital beds occupied at any given moment, meaning that we always had surge when we needed it. As of today, with the number of hospitalizations that we have, we are at almost 90% of our ICU beds currently occupied in the state of Colorado. That means that we have approximately 120 ICU beds available across the entire state. On the next slide, we have a new graphic here to show you kind of the relationship here between our COVID hospitalizations and our overall hospital capacity. And what you see with this trend line, which is in orange, versus the bar graph, which is in blue, is our waves of COVID hospitalizations over the course of this pandemic, and the trend of total hospital beds being available. The concerning figure here is obviously the precipitous downward trend of our total acute care beds that are available as of today. So for reference, on December 1st of 2020, where we hit our peak hospitalizations of COVID, which is 1,847 people hospitalized, we still had over 1,800 hospital beds remaining in the state of Colorado. Today, we have only 1,130 people hospitalized and have 934 beds remaining. The trajectory of hospitalizations continues to go up, making me even more concerned about what this is going to do to the capacity of our hospitals to take care of patients. Surgeries are being canceled. Brain surgeries, heart surgeries are being delayed because of a lack of availability to provide care to those patients because of the impact that COVID hospitalizations are going to have. So I will join the governor, I will join Dr. Herlihy in urging all Coloradans who have not been vaccinated to take that step to get their first shot. And for those who are eligible for the booster, please get it as soon as possible. Our healthcare workers on the front line deserve that from all Coloradans so that we can get back to our way of life. Thank you.
And I think you can sense just sort of the frustration we have, because we have the ability to end the pandemic. It'd be over if we had everybody vaccinated, no pandemic. I wouldn't be up here. We'd be doing other things. But we're not, because about a quarter of Coloradans have yet to make the decision to protect themselves. And as governor, I can say that I love you, I want to protect you, I want to keep you here, I love every Coloradan, but ultimately, you need to love yourself. You need to care about yourself and staying on this planet for yourselves, for your friends, for our community. We want you here. We want you to be healthy. Please get vaccinated. And if you've gotten the 2 doses of Pfizer, get that booster dose. Moderna and J&J boosters will be available within the next day or two to everybody. They're currently available to people who have weakened immune systems, but within a day or two, they will be widely available to any Coloradan who works around others, sees others, wants the booster. And every Coloradan can benefit from that, especially those age 50 and up. But it also can provide great peace of mind for people of all ages to prevent that waning immunity that we're seeing with regard to this virus. With that, we'll be opening up to questions.
You mentioned that you believe vaccinations are the #1 way for us to get out of this pandemic. But just seeing the lack of availability in hospital beds now, at what point would we see more preventative measures coming down? Would it just be when we see more deaths, or what's the measure there?
Well, let's go to that last slide there for a moment. I think I missed the last one. Yeah, my last one. I mean, the one I didn't show. Next one. Yeah. So these are the things that you can do. We know what people can do to reduce their risk. If you're vaccinated, get your booster. Get the flu shot. I got mine the other day. In a bad flu season, it can be as many as 300 hospitalizations. In a small flu season, 100 hospitalizations. We need this to be a small flu season, right? With 1,100 people hospitalized with COVID, we cannot afford a 300-person hospitalized flu season. So get your booster shot, get your flu shot if you've been vaccinated. Of course, get tested if you think you've been exposed to prevent it from going to others, and also so that you can take advantage of some of the treatments that are available if they catch it early. If you're not vaccinated, here's what you can do. Get vaccinated. Until you do, wear a mask, preferably a medical grade mask, even a surgical mask like this, whenever you're around others indoors. And if you're unvaccinated, showing love and respect for your neighbors is important, and that means avoiding large indoor crowded events. And of course, even more important for you, get tested if you're experiencing symptoms. It's so important to protect yourself, your family. You are more contagious if you are not vaccinated, and you also have a much higher risk of hospitalization, as we're seeing with the vast majority of the folks that are hospitalized today are unvaccinated in our state. So this is a very simple to-do list. If you're vaccinated, here's what you do. If you're unvaccinated, here's what you do. When people do this, we will finally help conquer this virus and end the pandemic. Again, moving to an endemic stage for this virus. This will be with us. It's not going away, but it's not at a level now that we can manage it. It is simply too high a risk for most Coloradans because there's too many Coloradans who have not yet been vaccinated.
Hi, Governor. CB Cotton here with Denver 7. Thanks for taking our questions. I just wanted to see if there were any updates to the vaccine rollout for 5 to 11-year-olds in Colorado.
Yeah, and I'll let, I think Scott will give a presentation on that. We have a major plan to roll out the 5 to 17-year-old vaccine. It's already available for 12 to 17, but we're including in our pediatric plans, really trying to boost it among the 12 to 17-year-olds as well. All we await is approval in early November. I'll turn it over to Scott Bookman to talk about those plans a little bit more.
Thank you, Governor. And we're going to go more in depth on this next week, but we are excited that this vaccine is likely to be approved in the coming weeks for our 5 to 11-year-olds. We are working very carefully with our local public health partners, our pediatricians, our healthcare systems to ensure that they are aware that the vaccine is coming, that they are ready to begin scheduling their 5 to 11-year-olds and their 12 to 17-year-olds to provide this vaccine for them. And then we're also working with community partners to ensure that we have large-scale events and areas where the community can easily access this vaccine. We've got a robust planning process underway, and we'll provide more information on that next week.
So, yeah, in answer to your question, I've had the plans presented to me, but we're going to be presenting them next week. Since it's not early November, we wanted to keep the focus of today on boosters, since that's imminent. They're available already for Pfizer, already for Moderna with an asterisk if you have a weak immune system. But Moderna, Pfizer, and J&J probably within a day or two, hopefully by tomorrow, will be available to everybody. And then we have a couple weeks until the 5 to 11 is available, but we're going to go through in detail the rollout plan for 5 to 17 with the new group being 5 to 11 next week. Thank you.
Hi, Governor. Seth, the Gazette. CDPHE told me that there are 12 National Guardsmen helping, with hospital staffing in various capacities. Are you planning on increasing that at all, increasing the number of military personnel, either via the Guard or requests to the Pentagon to help hospitals with their staffing issues? And if not, what's the plan to address that?
We would not have had the success we've had in Colorado in combating COVID-19 without the contributions of the Colorado National Guard. Amazing work that they've done from early on in testing at long-term care and nursing homes to helping with the mass vaccination effort. I want to thank the members of the U.S. military and the Colorado National Guard for stepping up in the time of need. Of course, we're also looking at what they can do to help end the pandemic, helping with the additional booster and kids drive, but also helping with our hospital capacity crisis that we have, especially in El Paso County.
Governor, this is Michael Abeda with CBS4. I guess I'll just jump in here real quick. And maybe this is a question better for Dr. Herlihy, but do we have any data statewide about breakthrough cases and what vaccine those people may have gotten?
So we have all that. We do have that by vaccine. We're happy to get that to you.
It's on our website, too.
Yeah, it's on the website, covid19.colorado.gov. We can make sure our press team follows up. I'll let Dr. Herlihy characterize it as well. But what we see in Colorado is entirely consistent with the national data. In fact, it was first presented to me from Dr. Herlihy and the Colorado data, probably about a week ahead of the national data, that they showed that there was a greater drop-off in the Pfizer efficacy, the need for boosters even higher, a drop-off in Moderna, a drop-off in J&J, although it's hard to measure just that in Colorado because it's relatively small numbers. But now we are very grateful. Everybody who got Pfizer should get boosted. The results from the Pfizer study are very stark. Again, 10,000 people, 5,000 got the booster, 5,000 got 2 doses. The 5,000 that only got 2 doses, 109 symptomatic cases of COVID. The ones that got the booster, 5 cases out of 5,000 people. So I'm really proud of our team in Colorado for identifying the drop-off and the breakthrough cases, the need for the boosters, really about a week before the national data came out. I'll see if Dr. Herlihy has anything to add on that.
Sure, so I can just add to what the governor said. So what we are seeing here in Colorado is exactly the same thing that's been measured nationally. So our highest rate of vaccine breakthrough cases is occurring among individuals that have received the Johnson & Johnson vaccine. That is not surprising to us. We knew coming out of the gate that the Johnson & Johnson vaccine had slightly lower vaccine effectiveness associated with it. And then next is the Pfizer vaccine, and then below that is the Moderna vaccine. So we see the highest levels of vaccine effectiveness here in Colorado associated with the Moderna vaccine. And that same thing has been observed across the country.
And the action we're expecting from FDA and CDC in the next few days will allow for the booster regardless of which vaccine you got. And we hope also allows for mix and match, which there's ample data on from Europe and other places on the world just to increase convenience for folks as they get their booster.
Governor, this is Vinny Deljudice at Bloomberg News in Denver. How close is Colorado to crisis standards of care, hospital rationing, as we've seen in Idaho and this week in New Mexico? Is the state close to pulling the trigger on this? Thank you very much.
So the state had crisis standards of care until earlier this year. I believe they were suspended in February. We'll get you the exact date. Those are ready to be re-implemented if needed, potentially tweaked or improved if necessary. I'll be meeting with our hospital heads later today in regular discussion with all of our providers with regard to when or if we need to reinstitute those crisis standards of care. And again, Coloradans can take a simple action to avoid that risk, avoid wait times in the ER, avoid having to have a heart surgery delayed. And that simple action is to get vaccinated, get protected, and get the booster if you've had 2 vaccines already.
I'll clarify my question from earlier. When I mentioned preventative measures, I was sort of speaking about public health orders. So at what point could we see those come?
Yeah. Okay, so maybe I didn't understand. So we are seeing in, counties with higher incidence taking increasing steps. I want to appreciate Larimer County Health and the Larimer County Commissioners for increasing mask wearing in Larimer County. Boulder County, you saw Boulder County had one of the lower COVID rates correlated with the vaccine. It's also no doubt correlated with the steps they've taken locally around mask wearing. Although you've seen other highly vaccinated counties like Eagle and Broomfield that don't have mask wearing also have low rates simply because of the vaccination. So there's a lot of steps that people can take, avoiding large indoor gatherings, wearing masks around others, ventilation in windows, in places like schools, in addition to mask wearing, symptom checking, not going out or seeing other people if you're sick at all until you've been tested. You know, I had a little cold last week. You might have heard it. You know, my voice was a little off and a little stuffed up. I was tested every day, didn't have COVID, so I didn't have to take a day off from work. But it was really important to identify that, because if I had those symptoms, I'm vaccinated. COVID would probably present as very minor symptoms. I'd probably just have a stuffed nose or feel a little ill. But if I had COVID, I'd want to stay out of circulation for the quarantine period. Thankfully, I didn't, so I didn't have to take a day off. There's a lot of winter colds going around. It's just that season. So if you're experiencing symptoms, get tested. It's what we need to do to prevent it from spreading, especially because there's so many Coloradans out there that haven't been vaccinated yet. It can be very severe for them, and they'll wind up in the hospital, as 1,100 Coloradans are right now.
Governor, David Clue with Denver 7. It does seem like we're hitting this peak of COVID cases and ICU beds being taken by COVID patients at what couldn't be a worse time as we begin to enter the flu season, viral infections, other reasons for ICU beds and patients. How concerned are you that we're heading toward a critical situation in this state right now?
So most Coloradans have done the right thing and gotten vaccinated, right? And I'm asking 2 additional things of Coloradans who care about themselves, who care about our community, who've already been vaccinated. Get the flu vaccine and get your booster. Those are the 2 asks that I have of the vast majority of Coloradans, 75% that are doing the right thing. Of the 25% that haven't, you have a lot to worry about right now. The vast majority of hospitalizations are among that smaller and smaller group of people that are unvaccinated. The average age of somebody being hospitalized who's unvaccinated is almost 20 years lower than somebody who's vaccinated. Get vaccinated, get protected, and if you absolutely don't want to, please wear a mask, avoid going out to indoor gatherings, be careful. This could be deadly for you. It's widespread in our community. It can be nothing more than a sniffle for somebody who's vaccinated, but you could wind up on a hospital bed or respirator or even lose your life. We don't know yet exactly the trajectory this is going to take in Colorado. We've seen an elevated peak of cases, relatively steady at a high level the last week, slightly increased hospitalizations of great concern. We never know where this virus is going to go the next day, the next week, the next month. While we're hopeful that it takes a trajectory like it did in some of the states that had peaks a month ago, like Florida, and some of the southern states, we also know that it could continue at high rates like it is in the United Kingdom. The single biggest thing that we can do is, if you've been vaccinated, get the flu vaccine, get your booster. If you haven't been vaccinated, get vaccinated. And if you absolutely don't want to, please have the decency to wear a mask around others and avoid large indoor gatherings.
Governor, Charles Ashby from the Grand Junction Daily Sentinel. It seems like your messaging has changed a little bit there. You're now fighting 2 pandemics, the COVID and, as Scott calls it, the pandemic of the unvaccinated. Are you in essence telling people who have been vaccinated to save yourselves from those people? And what makes you think pushing for a booster is going to get any more people to get the vaccine in the first place?
Yeah, so again, the vast majority of Coloradans, including the majority of Mesa County residents, particularly those who are older in their 60s, 70s, and 80s, want to be protected from the virus. They view this as a net plus. I view that as rational. Most Coloradans do. I couldn't wait to protect my parents. They got the booster. I want your parents to have the same protection as my parents. The results and data from the booster are so encouraging and positive. To see that in a test group of 10,000 people, of the 5,000 that didn't get the booster, they had 109 cases, which is still much lower than it would have been among 5,000 members of the general public who weren't vaccinated. And of the people who got boosted, 5,000 people, only 5 cases of COVID-19. To reduce our hospitalizations, to end the pandemic, for those who are doing everything right and want to continue to do everything right and really be model Coloradans, get your flu vaccine and get your booster. For Coloradans who haven't yet been vaccinated, please get vaccinated to protect yourself. The virus will be endemic and the risk doesn't go away even when the pandemic ends. This has been, is, and will be a deadly virus. Fortunately, we have a widely available, free, quick, and easy way to protect yourself with a vaccine.
Hi, Governor. John Daly, Colorado Public Radio. Thanks for taking our questions. Question for you about Ball Arena, which is now seeing full capacity crowds for both the Avs and the Nuggets. The numbers are higher than they were in the spring when capacity was lower. Should Ball Arena take additional steps, or the city, to reduce the potential for transmission? And how worried are you about transmission in a crowded indoor setting like that?
Among a audience of fans that are vaccinated, I have a very low level of concern. It's not impossible. I can't guarantee zero transmission, but the risk is low, the risk is tolerable, the risk is minor if fans are vaccinated. I have not yet been to an indoor game. I went to Rockies games during the season. I wish they had a better season. I got to, I think, 2 or 3 Rockies games in the All-Star game this year, of course, after I was vaccinated. If you haven't been vaccinated, I would really want to alert Coloradans to the danger of attending those kind of large indoor events. Get vaccinated, but until you do, until you have the chance to protect yourself, it's really important to avoid those kinds of crowded indoor events, which you could easily contract the deadly virus, which could send you to a hospital, put you on a respirator, or even cost you your life, as it's cost the life of over 7,000 of our fellow Coloradans.
Hello, Governor. Jesús Carrasquel from Noticias Univisión, Colorado. Gobernador, ¿puede decirnos cómo se prepara y a partir de cuándo el Estado de Colorado piensa suministrar la dosis de la vacuna de COVID-19 en los niños?
En la empieza de noviembre, el vacuno, podemos dar la vacuna a niños entre 5 hasta 11 años de edad. Ya son elegibles niños de 12 hasta 17 años, y si lo tienen, es importante para sus niños entre 12 y 17 para recibirlo ahora mismo. Para los más jóvenes, como los míos, yo tengo hijos de edades 10 y 7, ellos pueden recibir la vacuna en noviembre. Estamos actualmente estableciendo todos los sistemas ahora necesarios para estar listos para vacunar a los niños apenas nos den la luz verde. Thank you, everybody. Get protected, get vaccinated, get boosted, get the flu shot. Let's stay safe, end the pandemic. Thank you.